Spontaneous Speech Therapy Tools presents Aphasia, the basics on diagnosis, prognosis, and recovery. Aphasia is a neurological disorder that is caused by damage to the portions of the brain that are responsible for language. Primary signs of the disorder include difficulty expressing oneself when speaking, trouble understanding when spoken to, and difficulty with reading or writing. Aphasia is not a disease, but rather a symptom of brain damage. It's most often seen in adults who have suffered a stroke, but can also result from brain tumor, infection, head injury, or dementia. It is estimated that about 2 million people in the United States suffer from aphasia, and that's a lot of people. The type and severity of language impairment depends on the precise location and extent of the damaged brain tissue. And generally, there are three broad categories: expressive aphasia, receptive aphasia, and global aphasia. So let's take a look. Expressive aphasia, like the name implies, involves difficulty in conveying thoughts through speech or writing. The patient typically knows what he wants to say, but cannot find the words needed. Receptive aphasia includes difficulty understanding spoken or written language. The patient hears the voice or sees the print, but cannot make sense of the words. Global aphasia results from severe and extensive damage to the language areas of the brain, so patients with this type of aphasia lose almost all language function, both comprehension and expression, leaving them unable to speak, understand, read, and write. In terms of prognosis, the outcome of aphasia is difficult to predict because there's such a wide range of variability of those who suffer. However, generally, people who are younger or have less extensive brain damage fare better, and the location of the injury is also important and gives other clues to prognosis. In general, patients tend to recover comprehension skills more completely than those involving expression. And how does this recovery take place? In some instances, recovery is spontaneous and the person recovers completely without treatment. But unfortunately, that doesn't happen very often. In most cases, language therapy should begin as soon as possible. A speech-language pathologist should tailor a treatment program to meet individual needs of the patient. The rehabilitation process usually involves extensive exercises where the patients practice speaking, repeating, reading, writing, and following directions. The three main goals of aphasia therapy are: number 1, to help you communicate to the best of your ability; number 2, restore as much language as possible; and number 3, find alternative methods for communicating. Evidence suggests that speech therapy is most effective when it's started as soon as possible. For many people, the most significant recovery occurs within the first 6 months. However, improvements can continue to be seen for much longer after this, months, years, even decades later. Scientists have proven that factors that influence the amount of improvement experienced is based upon the cause of the brain damage, the area of the brain that was damaged, the extent of the injury, the age and health of the individual, education level, handedness, and overall motivation to improve. It's important to remember that a person with aphasia may have difficulty retrieving words or names, but that the person's intelligence is basically intact. Aphasia is not like Alzheimer's disease because for people with aphasia, it's the ability to access ideas and thought through language, not the ideas and thoughts themselves, that's disrupted. To learn more about aphasia and Aphasia Awareness Month, go to strokeassociation.org.